So we continue with our health theme today on the program as world leaders will gather in 3 days at Nasrec in Johannesburg. We heard that global health issues will also take center stage. Here are ongoing disease outbreaks, challenges of healthcare access, vaccine equity and pandemics, which will form part of the leaders' discussions that will lead to policy formulation and shaping the world agenda, and this will be on health. In studio now, we're joined by SABC Specialist Researcher on Health, that's Zandi Myeza, who will help us unpack some of the outcomes of the G20 ministerial committee meetings and also outline some of the expectations and progress that has already been made. Thank you so much for your time, Zandi. Always great to chat. So we know that the various committees have been hard at work, especially on the sidelines of this very important summit. Talk to us about what the Working Committee on Health has been doing.
So thank you, Polisi. We've had a few of these G20 health working groups meeting and having deliberations throughout the year so far in the lead up to the Leaders Summit, which will be taking place later this week. And some of the key things that have come out, just to give you a bird's eye view of the compelling things that we were monitoring throughout the year, is that these health leaders and health experts met and talked about sustainable financing and equitable healthcare. And it was very encouraging to see a conversation on financing alongside increasing access. You need the money to make healthcare accessible. So it was very encouraging to see that conversation resonate throughout these meetings, which have been taking place throughout the year. Now, one of the key pillars that stood out for us as we were monitoring these meetings is the conversation around pandemic prevention, preparedness and response. We saw the structural shortcomings of health systems around the world with the COVID-19 pandemic, and we also witnessed how inequalities were very evident amidst an outbreak. So essentially, health ministers and health experts met and said, we need to have a pandemic agreement. We saw the formation of a pandemic agreement and what they called the 100 days mission. This essentially means that within 100 days of identifying a threat, vaccines, therapeutics and diagnostics need to be made available swiftly to all countries that need them. With COVID-19, we saw in some parts of the world where the outbreak far surpassed the pace of the response. So it was very encouraging to see that committees and task force on financing and preparing for pandemics were formed during these meetings throughout the year. It's imminent, and pandemics are imminent, and it was encouraging to see that these health experts are basically saying we need to prepare for future pandemics. Another pandemic is coming. How do we capacitate countries to be able to provide vaccines, locally manufacturing vaccines? We know South Africa is playing an important role in manufacturing vaccines. Equity means that people must be able to access something, and essentially throughout the world, those that need it. And what we saw with the vaccine manufacturing challenge is that if we can provide vaccines and manufacture them locally at a lower cost, that essentially increases equity. It increases how many people who need it most will be able to get the vaccine. So it was really encouraging to see South Africa play a very significant role in the vaccine conversation, locally manufacturing vaccines, making the African region more self-reliant and more self-sufficient in that conversation. So it was really encouraging to see some of those discussions come out throughout the year. I think one of the other key things that were important were human resources for health. That's something that was also quite important. How do you build strong and resilient health systems around the world as part of universal coverage if you don't look into your human resources for health? You need healthcare workers who are healthy themselves, and all the key issues that are surrounding key workers in the health sector were also discussed.
And you know that now that you make mention of vaccines, we've had something groundbreaking come out of South Africa with that very first cholera vaccine that Dr. Motsoaledi actually spoke about. But we're not going to focus and delve on that at the moment, but it shows that the wheels of change are actually grinding, albeit at a small pace. And you also mentioned that, you know, there was some groundwork that was put in terms of ensuring that conversations are steering towards saying Africa's time for vaccines is now. What sense are you getting? Are you getting a sense that we have the capacity for all of that?
Oh yes, I think South Africa is playing a very integral and critical role in terms of making sure that the African region is more capacitated and self-reliant in terms of vaccine innovation. We see South Africa playing a critical role in the space of scientific research and innovation. How do the science that informs these vaccines, South Africa is playing that role. Some of the country's leading health scientific experts are part of these vaccine clinical trials, and they are principal investigators of some of the most compelling studies. So I do see South Africa playing an encouraging role in the vaccine conversation, and definitely the African region is positioning itself to be more self-reliant.
And there is, just to expand on that aspect of capacity, so much has been said around what we really put into making sure that we have efficient health systems that are, first of all, fit for purpose, but service greater and larger communities, because the reality is healthcare and quality healthcare is expensive.
That is correct. Healthcare is extremely expensive, and the Minister of Health, Dr. Aaron Motsoaledi, has been speaking throughout the year, and essentially he is saying that healthcare should be something that is affordable and accessible to all. And a steep price tag on healthcare, it really does impede on the goals of improving healthcare universally for everyone. So he wants to change the conversation around healthcare from a financing conversation about who can afford it and who can't, but as a basic human right that we need the finances to accommodate everyone regardless of your socio-economic status.
Yeah. And to zone back into those health working groups, we know that TB and HIV featured quite prominently. Many critics have said that HOSA's bolted long ago. Talk to us about what was happening on that front.
So the G20 health ministers meeting took place recently, and one of the key things that was discussed at that meeting was HIV and TB. Now, these two communicable diseases, which are also known as public threats and are very much still part of the Sustainable Development Goals by the United Nations. And the conversation that health ministers had in Polokwane recently in South Africa was that we needed to find a way to bring down the number of people dying from TB, because TB is curable, and we need to advance a TB vaccine candidate. And then on that HIV conversation, they were talking about HIV prevention, which was also quite interesting and refreshing, because for a change, we were discussing HIV prevention rather than HIV treatment. And there's been a lot of advances that have been made in the HIV prevention space. Scientific advances have led us to what is now called lenacapavir. It's a 2-yearly injectable pre-exposure prophylaxis, commonly known as PrEP, and this is an HIV prevention tool. And it has been, declared a game changer of some sort, because it will bring down stigma, and it will also improve adherence, because people can go to their local clinic only twice a year to get this HIV prevention tool, to be used alongside other HIV preventative measures. But it is a game changer in the sense that there are priority groups. These are people in our community, in our society, who have been identified as those at highest risk. We know young women and girls still bear the brunt of HIV infections. So health ministers met to say, how do we make this lenacapavir available to all, especially those that need it? For example, the G20 member state countries are they account for at least 70% of the TB burden globally. So countries like China and India are among high burden countries. South Africa is also one of them. And TB is curable, but we still see so many people dying. So a TB vaccine could really change the trajectory of how we address this disease. So yes, health ministers met and they discussed TB and HIV quite significantly.
Right. It's actually encouraging to see that inroads are being made to ensure that we have quality access for all. And I must thank you so much for your time this afternoon. Zandi Myeza is SABC's Specialist Researcher on Health. Thank you so much for your time on the program.
Thank you.